According to the ruling announced by the Court of Final Appeal, every child born in Hong Kong has the right of abode in Hong Kong, although their parents do not have the Hong Kong identity card. Since this ruling, the number of mainland couples giving birth in Hong Kong has been increased. Now the accumulation of the number of births is about 140,000. In last year, there were about 88,000 of newborn babies in Hong Kong, and 32,000 of them, their parents were both mainland citizens. It had increased about 32 times since 2002. Dr. Zhang, who is a gynecologist, said 7,000 of pregnant women, one-third are non-local citizens. He mentioned that if the government keeps receiving pregnant women who are from mainland, it is totally impossible for them to handle it. As Dr. Zhang mentioned, there are 10% of vacant positions of gynecologists and 12% of vacant positions of nurses. It means there are 200 doctors with only 18 professional doctors. It is strenuous for the doctors and nurses. Miss Leung is a nurse. She mentioned that she now needs to work overnight for a week, so she and her fellow workers feel extremely exhausted. Recently, they are provided held by the local mother and pregnant women in order to express their anger. One of the mothers, Miss Yu, expressed her anger. She said when she was in the hospital, there were no doctors concerning her need and feeling when she was in pregnant period and after birth. Besides, Karen, who is also a mother, she mentioned that her bad situation inside the hospital. In her cases, I found out that the need and health of local pregnant women are totally ignored by the hospital, as some of the pregnant women have to sleep in the pathway, where it is uncomfortable to sleep and be tired. After worrying about the hospital beds, mothers also need to worry about the future educational resources for their children, as more and more non-local children whose parents are from mainland coming to Hong Kong to study, which may need to compare with local children. The government can offer more financial support to each public hospital for establishing more hospital beds and importing more medical resources. It can release the stress of scarcity of beds and medical resources. Also, the Hospital Authority Ordinance should provide more training and nurses courses in order to decrease the vacant position of doctors and nurses. The direct way to decrease the number of mainland pregnant women giving birth in Hong Kong is to restrict plenty of pregnant women come to Hong Kong by setting quota. For example, 8,000 of mainland pregnant women are allowed to give birth in Hong Kong per year. It can definitely decrease the situation that local pregnant women do not have enough hospital beds, but need to rest in the pathway. In recent years, trading hospital beds has become a hit business in Hong Kong and mainland, so many middlemen guarantee that everyone can have a hospital bed unless you had to pay a comparatively higher expense to them, which is totally unfair to local pregnant women who do not have offer in hospital. Even though they have offer, they need to pay more. So the government should set ordinance to inhibit those illegal trading.